My name is Gretchen and I am 38 years old. I love plants and my dog and the color green. My doctor was Dr. Mark, and I had a left total knee replacement done almost 3 months ago. I also got the Smart Knee. So the Smart Knee, basically, it doesn't track your location. It just tracks your healing progress and gives you prompts for when you are in physical therapy and on the days when you're not doing physical therapy. They send you notifications, and then you can track your progress alongside other people with your same age range and conditions. In January and February, I started having a lot more trouble with my knees. It actually started in September when my knees started blowing up with fluid. And I would have to go to the doctor, my rheumatologist, every couple of weeks, and they would drain over 100 cc's of fluid from each knee. So it just kept getting worse and worse. And in January and February, I realized it really hurt to walk up the stairs. So I broke out my old college crutches and I started using them to get up and down the stairs. Previously went to another doctor. He recommended that I see a bariatric surgeon, go to physical therapy, and then come back when I was closer to 50. So I left. I called Seaview Orthopedic. I called up and I asked for their nicest doctor, hopefully try and get someone who would listen to me. I came in, they took x-rays, and I saw Dr. Mark. He walked in and he said, "What hospital do you want to go to for your surgery?" And I didn't have a lot of feelings at that time. It was just kind of like, oh, so this is what's happening. This is happening. I'm 2 weeks away from my right total knee replacement, and I can get my life back. And that's really how I feel that this whole thing was, is that it's me getting my life back. Before surgery, I had no quality of life, and the pain was excruciating. I was icing all the time. I basically went to work, drove home, and laid in bed all night because that was all I could do. I didn't get to go out on the weekend. I didn't have any fun. I spent a lot of time alone. Because as a disease, rheumatoid arthritis and fibromyalgia can be very secluding and lonely. But there are things that I want to do, so I honestly made the best decision for myself that I could at the time, which is the total knee replacement. When I called up, apparently I was already in the computer. I didn't remember coming here before, but after my experience with the other practice, I was never going back there ever again. I didn't want to be dismissed, and so like I said earlier, when I called up, I called and I asked them, please give me the nicest doctor you have. I was actually scheduled with Dr. Vasson first, and he's a hand guy, which I might have an issue later, but not right now. Right now it was my knees, and he was really nice, and I told a little bit of my story, and his reaction made me feel really comfortable, and he said, I'm gonna go get my colleague, which was Dr. Mark, and then Dr. Mark came in, and that's when he asked me what hospital I wanted to go to. It was very quick, but satisfying, because I was listened to. They looked at not the fact that I'm overweight, not the fact that I'm 38, not the fact that I have a rheumatologist or fibromyalgia or RA. They looked at my actual joints, and they were he said afterwards that I had a pothole and a divot in my knee. So it was good that he went for the total knee replacement. Otherwise, the partial would only lasted me for 5 years. So for the first time in a long time, I have hope. Okay, I'm laughing because I was a nervous wreck. I barely slept the night before. I said to one of the nurses who was, I guess, getting my vitals, that I was getting the smart knee. And they were like, what was that? I couldn't really describe it because I was such a nervous wreck. And when Dr. Mark came over, he starts describing the smart knee to them. And I just remember thinking, like, he's really excited about this smart knee. And I just remember thinking, like, how, like, funny it was. And just, I basically was a nervous wreck, but I had a sense of humor about the whole thing. It was a great experience. The hospital was great. Dr. Mark was great. I felt completely comfortable with him. Physical therapy was tough. I'm still healing. Every day is kind of like a new benchmark, and once I've hit that benchmark, I get very excited. And my physical therapist did tell me, he said, don't compare yourself with anybody, just keep working. And I'm not 100%, but I can walk again and without aids. So the day I could put the cane down, I was very excited. The education in the app is very user-friendly. They have encouraging prompts, they have education, they count, your days from surgery, and then they compare your progress with people in your age group. You just have to set yourself up for success. If you have someone who can stay with you, great. If you can't, pre-make some easy meals or stick with like smoothies, something you can shake. If you live in a 2-story house, get everything you could possibly need upstairs and downstairs. If you want to do things like, I wanted to hike again. I love hiking. I like walking my dog. Simple things like that. That's just, it'll give you your freedom and your life back. But yes, it is scary, and I hope that you have a support system involved, but it's worth it. I don't regret it. And like I said previously in my interview, I am going for the second one in 2 weeks. So obviously, I'm doing it again.